By Section 63(1)(a) of the Public Finance Management Act, number 14 of 2020, the Act, the Minister of Finance may, by an affirmative resolution of Parliament, borrow from a bank or other financial institution for the capital or current expenditure of government. And whereas it is further resolved by Section 64 of the Act that money borrowed by the government must be paid into and from and form part of the consolidated fund. And whereas the Minister of Finance considers it necessary to borrow from the European Investment Bank the sum of euro 13,500,000 to finance emergency operating expenses in the health sector related to the COVID-19 virus pandemic. And whereas the loan is repayable over a period of 20 years from the date of the first disbursement of the loan, inclusive of a 4-year grace period. And whereas the loan payments shall be made consecutive, equal semi-annual installments. And whereas the loan payment shall commence after the grace period of 4 years. And whereas the interest is payable A, at a fixed rate of 1.35% to 1.45%, to be determined by the European Investment Bank at the time of disbursement of each tranche. B, at a floating rate of 3 months Euro interbank offered rate plus 110 basis points to 120 basis points per annum. Be it resolved that Parliament authorizes the Minister of Finance to borrow from the European Investment Bank the sum of euro 13,500,000 to finance emergency operating expenses in the health sector related to COVID-19 virus pandemic. Be it further resolved that A, the loan is repayable over a period of 20 years from the date of the first disbursement of the loan, inclusive of a 4-year grace period. B, the loan shall be made in consecutive equal semi-annual installments. C, the loan payments shall commence after the grace period of 4 years expires. D, the interest is payable, 1, at a fixed rate of 1.35 to 1.45%, to be determined by the European Investment Bank at the time of disbursement of each tranche. And 2, at a floating rate of 3 months Euro interbank offered rate plus 110 basis points to 120 basis points per annum. Mr. President, if I may offer some explanation with regard to this motion. This motion really is requesting or is seeking the permission of government to access this financing from the European Investment Bank to cover expenses incurred by the COVID emergency operating expenses. And if we can go back to some of the discussion we had earlier, some of these expenses incurred, unfortunately, in the last term, they were justified because we had a COVID pandemic and things had to be done. But we must know that we are now still paying loans. We are now still paying loans. And that is why earlier on I made reference to what we inherited. We are now still paying for quarantine expenses. All of these monies were borrowed. I did mention, Mr. President, over $300 million. But we are currently still owing for quarantine services. I believe that, these could have been written off already. Mr. President, we are still paying for vaccines that were ordered. And I will get back to that a little later, perhaps at a different stage of this discussion. This government is still saddled with it was originally what, 7 million, 6 million? Some was paid. We still started with over $5 million of outstanding debt with a claim that vaccines were ordered. And we still have not received those vaccines, but we're paying for that. Mr. President, there are other areas in the health sector, in addition to just the quarantine and the vaccines, that this loan intends to help strengthen. We now have heard of all the various variants of COVID, and we do not want to be in a position where we have to be reactive. There's also the looming threat of monkeypox. We've heard it in other parts of the world, and because we're a country that has traffic with tourists, and eventually some of those external issues will find themselves at our doorsteps. We're not waiting for a situation where we are visited by one of these unfortunate, unwanted circumstances to be reactive. We want to be prepared. And so, as we speak, the Ministry of Health is currently putting measures in place to ensure that should we have a case or should we have a situation that presents itself, that we are ready to deal with it. And so, part of this will be put towards measures to mitigate against such eventualities. We are hoping that we will not have to deal with it, but just in case, Mr. President, we want to be prepared. We also, Mr. President, by way of example, want to complement some of what we've already started doing as a government in the health service upon assuming office. We inherited a situation where the health sector was under tremendous stress, and I think members on both sides can agree that the health sector workers, the frontline workers, the emergency services of this country, they've taken a serious battering. Some of them are essentially tired and drawn out and beaten with all of the stresses that they've had to deal with. We'll try to give them some relief, but one of the things that this will do is to help to further strengthen the various aspects of the health sector. And one of them was mentioned by the Minister for Health when he made reference to 8 additional chairs and 1 dialysis unit that we have already purchased to improve the services offered for non-COVID related health issues. So while we do this, Mr. President, we must not keep our eyes focused on one particular issue. We know that COVID is a major one, but if we can work towards improving the overall health services, the overall health of the country, our people will be more able to deal with the other issues that come up. As we have heard in previous discussions, most of the deaths that were caused by the first wave of the Delta variant was as a result of pre-existing conditions, diabetes, high blood pressure, hypertension. We believe that if you can put systems in place to help to manage general health, primary health services, the various healthcare centers, and the hospitals, and we'll get to the hospitals a little later. Mr. President, you can then minimize or cushion some of the impact that can be caused by a disease like COVID. So it's not just responding to COVID as a single phenomenon, but really working on improving the entire health sector so that we are more resilient and more resistant to any pending pandemic or other unforeseen health emergency. So, Mr. President, I use those just by way of context, but I believe that this particular motion seeks to make use of these finances to help us to be a little more proactive and to be ready in the event of an unforeseen health-related situation, as well as strengthening the existing situation that we have in this country. So I hope that we can find reason to give support to that initiative, given the few examples and the context that I have established. Thank you, Mr. President. Thank you, Mr. President. I thank the 2 senators who contributed to the debate. just by way of a brief response to some of the issues that were raised by the leader of government business. I noted that he was careful in ensuring that when the figures were presented in terms of the 13.5 million euro, that he ensured that the figures were also quoted in EC dollars. Looks like opposition has done him well. In government, everything was US dollars. And, you know, it's nice to hear that we pay attention to the EC equivalent. So I commend the opposition for learning something. I may want to take back some of what I said earlier that they haven't learned. I think they're starting to learn. Also, Mr. President, I think the leader of government business did allude to the issue of carnival.
Correction.
Of opposition business.
Thank you very much.
Did allude to the issue of carnival. I suspect that throughout the course of his deliberations on this motion, which is related to health system strengthening and COVID response, the bulk of his contribution seemed to have focused on carnival. Now, I know he was a former tourism minister, so I empathize, but I want to remind him that he should know, of all persons in this chamber, the impact, economic impact that the tourism sector has on this country right now, and the valuable economic benefits of the hundreds and thousands of persons who take the opportunity to travel to this country because of carnival. So I want to remind the House that this motion is not about carnival, but it's about health. Mr. President, the leader of opposition business also spoke about the issue confronting the markets, and now that there are some concerns about flights in some countries, our source markets, I think this is true, and some of these external factors we have considered. So as a proactive government, the Tourism Ministry has embarked upon some serious analysis and aggressive marketing to ensure that we explore other source markets, because we know that our major source markets have been the US and the UK. And right now we have serious issues in the regional markets, and that is mainly because of the LIAT issue. And so we have been proactive to provide him with some response, that now that we are trying to strengthen our healthcare resilience and our healthcare system, that we ensure that whatever activities are happening out there, we have alternatives to what we currently have. Finally, Mr. President, the issue of bills being paid and the government, I think the leader of opposition business stressed on the investment that the government then made on quarantine facilities to make persons comfortable and compared the level of comfort. I have no issues with that. If the government felt that we should invest in quarantine at the time, I think that was okay. My issue is, these quarantine facilities were being used with a cost. The government borrowed in excess of $300 million in the name of COVID. Why is it that today, 2022, July, this government is still saddled with quarantine debt? The IMF gave you the money for COVID-related expenses. Quarantine facilities were part of your COVID-related expenses. You procured the services, or you secured the services of these quarantine facilities to house persons during that time. Why is it that after borrowing so much money, that we now have to be paying for quarantine? It was not a loan you were giving. It's an expense that was there. That should have been paid. This government should not have been paying for quarantine services today. So, Mr. President, I don't understand why the leader of opposition business, who was in government, who supported his then prime minister in borrowing all of this money that we now have to pay back for that particular purpose, is now sitting over there and chastising us who are trying to pay the bills they incurred albeit that they were for the country, and we're not complaining that they should have had quarantine. But you had money to pay for it. Pay your debts. We are still paying for vaccines. Pay your debts. You borrowed the money for that purpose. I'll say it in Creole. Gouvernement qui était là, là nous tenons problème COVID, prêter plus passer 300 millions de dollars en moins qu'il y a l'année pour yo dire yo ka payer pour dette COVID, pour affaire COVID. Yo ni teni place pour mettre monde qui teni COVID, yo ka couiller ça quarantine. Juste toujours yo te prêté 300 millions, juste toujours gouvernement nous à présent qu'a payé dette quarantine. Qui ça ou fait puis l'argent ou prêté pour COVID? And so, Mr. President, I think it is grossly unfair for anyone on this side of the House to ask this government questions about borrowing to now go and pay for the same debts that they incurred and they got money to pay. So now we have to pay the debts that they had borrowed, the money that they borrowed, which is already on our debt stock. And then we have to now find additional money to pay for the same things that they borrowed to pay. It doesn't make sense. That means we're borrowing twice for the same reason. And I think, Mr. President, he knows full well what was done with those monies. I don't want to get into that today or right now. But as we go on in the term of this government, a lot of these things will come to the fore and they will be dealt with at the appropriate time. So, Mr. President, in closing, I want to thank our members who contributed, and I want us to remind and assure this Honorable Senate that every cent of this money will be put towards exactly what it says, the strengthening of our health sector and the efforts towards dealing with the COVID-induced situation that we have. I thank you, Mr. President.